Hi, I'm Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. I hope everyone is doing well and staying healthy during the coronavirus pandemic. Today, I'm pleased to be speaking with Dr. Daniel White from the University of Delaware. Dr. White, along with co-authors Jakiela and Esther Waugh, wrote an editorial entitled "Walk at least 10 minutes a day for adults with knee OA. Recommendations for minimal activity during the COVID-19 pandemic," which is now available on open access article on the journal's website at jroom.org. Dan, I want to thank you for writing your editorial and for joining me and agreeing to discuss the editorial. With somebody at my age with mild OA of the knee, I look forward to this discussion as I did reading your editorial. Okay, no further ado, first question is, so what was the inspiration for writing this excellent editorial?
Yeah, it's a great question. It's something that, the pandemic really has fundamentally changed life and how much we do, and the decline in activity overall with such changes, in daily life. And, me along with Jason, Jakiela, and Esther Waugh were really concerned about, adults with arthritis, since this group is really at risk for just poor future health outcomes associated with inactivity. And so we wanted to put forth just a simple recommendation to help strive to mitigate the sort of pandemic-related social distancing and subsequent changes in physical activity, that are associated with that. And so, yeah, that's basically, our reasoning behind wanting to write the editorial.
Thanks. I didn't give you this question, but I'm going to ask you another question. You didn't put in get a dog.
You can get a dog.
That would solve the problem.
Dog, if it poops and pees in the house, that's not on us, but it will make you go for a walk. That's for sure. And that is, there's some research to show that, especially for older adults, having a pet or, something that needs to be walked every day and has a tail and wags is a great way to get your.
I'm telling you, and after having just returned from my walk and you hear the dog in the back, on perfect note, she decides to bark. Okay, so going back on script, what are the important take-home messages of your editorial?
Yeah, well, first, as the title implies, walk for 10 minutes a day. It's simple as that. And we also recommend that the walking be at a purposeful or brisk pace. And this is basically at an intensity where you are building up a sweat eventually, but you're still able to have a conversation. Most people, if you're walking from here to the bus stop or someplace at your usual pace, that's enough to be a brisk or moderate intensity. So it's really not super intense. So the next thing is don't stop at 10 minutes either. You don't have to say 10 minutes, that's it. For some people, just give me the minimum. Well, there's your minimum, but that is no way a maximum. And the more you do, the more benefit you have. And lastly, to know that, walking is actually a really potent and powerful and simple way to manage osteoarthritis or arthritis of the knees. And it is indeed beneficial. So those are our basic take-home messages we wanted people to have from the editorial.
So, it leads right into my next question. So as a physician, and I tell my patients that pain's an indication that you're doing too much. Your body's trying to tell you something. And certainly people with osteoarthritis, I'm sure, when this brisk walk, especially if they push it longer, will develop some pain. And you would actually mention that that's okay. And so why is osteoarthritis different, let's say, than an overuse syndrome of a muscle where, it's telling you stop?
Yeah, that's a great question. I'm glad you asked it, and certainly a fair question. And I agree, pain is often a sign that something is wrong. But for arthritis, we now understand pain to be actually a little more complex than before. And it's not quite so straightforward. There's different types of pain. There's different, not only intensities, but the quality of pain and when it comes on and comes off. It is actually much more complex than we originally understood it to be. The good news is that there's been countless studies that have been done that consistently show that exercising, and specifically walking, actually has the same magnitude as for reducing pain as taking normal drugs like NSAIDs. So, you know, in addition to that, walking or being physically active has other benefits to health that range from just feeling better all the way to reducing your risk of future diseases such as cardiovascular disease, some types of cancer, and dying early. So, you know, we initially as a medical community, we didn't expect this result, but physical activity, you know, if you can put that in a pill, that's the best blockbuster drug you could ever come up with. So, you know, knowing walking is a potent treatment that can reduce pain for arthritis is a key message. Now, I will say, people, when you first start, you will have pain afterwards, and that's not going to feel good. But the key thing is to consistently get up to being to walking and to try it again. Now, if it's pain that is that sharp pain that's in your knee that lasts, then we've done too much. But if it's that dull aching pain that kind of that you kind of always have, you're good, and walk again, and it should get better. And countless studies have shown that. So I hope that answers your question. But and again, that is a really good question.
Perfect answer. Yeah, the pain, not all pain is equal, really. So, and really, and so how do we overcome, again, this idea of walking on something that has some damage to it? How do we overcome that misconception that I'm actually harming myself by walking, especially when I'm feeling pain when I walk? So now there's these two things that are coming to me that go intuitively against what I think.
Yeah, that's a great question. You know, for patients that are listening to this right now, or people who have arthritis, you know, you listening to this, you're already there. You're hearing the message that, you know, walking does not lead to future damage. There's just no evidence for that. There is countless studies, large randomized controlled trials that have measured damage to the joint looking at x-rays or MRI, and there's just no evidence to show that being more active increases the rate at which people's damage occurs. And then for providers, you know, I think the main thing is we just need to consistently work on recommending walking with the knowledge that it is an effective and potent treatment. It's not just a, you know, feel good, you know, content-free thing we're saying to our patients, but in fact, saying to somebody, you should walk for 10 minutes a day is actually a very potent thing that they will take in to their daily lives, most likely, and realize that it's an effective way to help manage their osteoarthritis. And you know, and for patients, you know, I understand for physicians, you have a limited time with your patient, and behavioral change is very challenging. So, you know, recognizing that there's this group of health professionals that are, I would argue, almost overly trained, called physical therapists, that are excellent in helping people overcome their challenges that they have in life. And walking is a definite goal. Walking more, especially for people with osteoarthritis, is a definite goal physical therapists have. And so consider referring your patient to see a physical therapist to improve their function and their ability to walk is certainly a resource that health providers can consider.
I think that's great. I think any physician who deals with osteoarthritis, even inflammatory arthritis, and doesn't have a physiotherapist involved is not really looking at what we now call patient-centered care. I think we have to make use of allied health professionals, and that's what they're good at. I mean, I know what I'm good at, and I still go to my physiotherapist. You know, I've been doing this for 35 years, and I think I'm pretty good at what I do. But they're very good at what they do also. So let's all work together. Just like my nurse has a role in my clinic, my physiotherapist has a role in my clinic, and I think even more so, to be honest, in osteoarthritis.
Yeah.
I think the physician has a management issue in a broader sense, but on a day-to-day and the problems come up, you go to your physiotherapist. I endorse it 100%. Sorry to make it a lot easier. We're in the same place, and I think, and as editorial, as the editor, we have a physiotherapist on our board. So we really believe in physiotherapists. So
that's great.
So after a nice pat on the back for each other, I want to ask you, do you have any other final thoughts that I may have missed that you'd like to leave the audience with?
Yeah, I just think that, with this opportunity to speak about this editorial, my doctoral student, Jason Jakiela, and Esther Waugh, we've worked hard to really cull down all the information out there just into a simple recommendation. And we just want people to know that, walking 10 minutes a day is a realistic goal for most people with knee osteoarthritis. And, I just put out the challenge to people who are trying to manage their osteoarthritis or their arthritis in their knees to try to reach that goal, and maybe even go beyond that, especially during this pandemic. It is critical to try to be as active as possible. And you'll be surprised. I think you'll be likely very surprised. And not only that, you'll feel better. So that's all I have to say.
I agree. Those endorphins with exercise really do make you feel better. And I just want to tell everybody, I endorse it not only for osteoarthritis and for everybody that needs their outdoor exercise, particularly as we're sitting in the house in the pandemic. So I really want to thank you for writing the editorial, agreeing to speak, and it really is an excellent editorial, really for simple people like me, easy to read, succinct, summarizes everything. I don't have to go to the literature, so I think it's a great idea. And again, it is available as open access. So again, I want to thank you and your co-authors for writing the article and for taking the time to speak to me. And the audience, I advise everybody to please read the full editorial entitled Walk at Least 10 Minutes a Day for Adults with Knee OA, Recommendations for Minimal, remember that, minimal activity during the pandemic, by Jakiela, Waugh, and White, as well as our other special editorials about SARS-CoV-2 infection and COVID-19 and its effects and implications for rheumatologists and rheumatology. Practice at www.jroom.org/COVID-19. If you have any questions or comments, please message us on Twitter, the tag of @jroom, or email us at manuscripts@jroom.com. And I want to thank everybody for joining us, and please continue to follow the guidelines of your regional and national health authorities. Wear a mask as described by your health authorities, and be sure to maintain social distancing in order for all of us to stay safe. Thank you.